I'm Aidan. I'm the co-founder of Nourish. We did not hold the Series A for this, but it was a nice coincidence. So a few years ago, I was having pretty severe chronic migraines. At its worst point, I was having daily, quite severe migraines. And obviously, when you're having that, it's the number one thing in your life you're trying to solve. So I tried everything. I tried my primary care doctor, specialists, tests, medications, and nothing worked until I got referred to a registered dietitian. And long story short, after a couple of years of struggling with migraines, within the course of a couple of months, a registered dietitian put me on what's called an elimination diet. And through a trial and error process, was able to identify the triggers for my migraines and get them completely under control. So it really was one of those cliche life-changing moments. But what got me excited about starting a company in the space with my co-founders was we dove deeper and understood the larger problem here. So I think most people know from their own experience that healthcare is pretty broken in the US. But once you start diving in, it's pretty staggering, the numbers. As Americans, we spend 20% of GDP, which is about $4 trillion on healthcare. And over the course of the last 50 years, we're getting less for that each dollar. And all these numbers, the prevalence of chronic diseases, and unfortunately, the number of people who die from these chronic diseases has skyrocketed. And the vast majority of those diseases, when you dive in, are downstream of nutrition. So it's not just stuff like migraines, although they're painful. It's the most important conditions that our system struggles with. So diabetes and eating disorders and GI conditions and heart disease and high blood pressure and cholesterol and obesity, all these things add up to be about 1 in 2 American adults. So it's a staggering problem. It's one of the most important problems that my co-founders and I thought we could work on. Fortunately, there's a solution that exists. You guessed it, from my experience. Registered dietitians are quite effective at treating these conditions. They're the experts in the space. And for that reason, they're quite generously covered by health insurance. So both commercial and health insurance that you might get through your current employer, but also government insurance like Medicare and Medicaid cover dietitians quite generously. Most people don't take advantage of that benefit because, one, awareness. Most of you probably didn't know that you had this benefit, and most people are like that. But two, even if you do know about the benefit, it's very hard to find a dietitian who accepts your insurance. Because in the same way that health insurance is a pain in the ass for you, it's also a pain in the ass for providers. And so they find it difficult to accept insurance. And so that's where Nourish comes in. Our platform connects chronic condition patients of all different types with registered dietitians over telehealth, and we get it covered by their insurance. And so on the patient side, the problem we solve is, one, the insurance coverage. So the vast majority of our patients pay nothing at all out of pocket, over 90%, and they're able to get unlimited visits with a dietitian. But we've also built a lot of cool software tools around this experience. So you can not only have the telehealth appointment and get it covered by your insurance, but also access a whole suite of tools that interact with your dietitian. So messaging and meal logging and content that's tailored to your condition and tracking your progress. And then on the dietitian side of the equation, as I mentioned, we make it really easy for them to accept insurance. So dietitians, like a lot of professions in this country, there's a big desire to have the flexibility of being, sort of this gig worker that you've seen in other parts of the sectors, being your own boss, setting your own schedule, and making a good living. And so we enable to do that. We let them take insurance. We do a lot of the back office of that, in addition to marketing them. And we basically give them a business in a box so that they can use all the tools that we just saw and manage their practice on our platform and make a good living. On average, dietitians make about $40,000 to $50,000 a year in the private sector, and on our platform they can make $80,000 plus. And so we launched a little over 2 years ago, as I mentioned, and we've had a lot of exciting growth. So in just 2 years, we've gotten to 25 million run rate revenue. We're serving over 10,000 patients a month across about 20,000 appointments and 450 providers on the platform, and growing super quickly. So if you see here, the opportunity, we're just scratching the surface. With 450 dietitians on the platform, there's about 110,000 in the country, and it's growing quite quickly in response to the chronic condition crisis. And then, of course, there's 150 million Americans with chronic conditions, and so we're just scratching the surface there. And so, as Jen said, we just raised a Series A on the back of this growth and on the back of this opportunity. And so there's a lot to do. We want to scale up both sides of the marketplace that you see here, but we also want to build a lot of cool technology, because the vision is ultimately not just to be a marketplace, but to attach a world-class consumer app to the experience. And so in total, we've raised a little over $44 million, counting the 35 million Series A that we actually announced today. And so we're hiring for a number of roles. We have an office in Flatiron, not far from here. We have 38 people on the corporate team. About 25 of those are in New York. We do hire for hybrid roles, but we're leaning into the in-person thing as much as possible. And so you can check out our careers page after this, but we're hiring across a number of roles: finance, ops, end product design, data roles, and more to come. So please introduce yourself after this if you're looking for a role, even if it's not on our careers page, because we like to hire great people when we find them, not when we need them. And so I think we have a pretty special culture here. You can see some pictures of the team, but my co-founders and I are really close. That's why they snuck in here today. So they're over there. I think they technically weren't supposed to be here right now, but that gives you a sense of the culture of our team. You know, we're close and scrappy. So, so come find one of us after if you're excited about the mission. Thanks for listening.